A very good evening and a very warm welcome to all the respected doctors who have joined us this evening for yet another session in the series of NEFFRON. Just to set the context, NEFFRON is an educational initiative by Saffron Formulation that involves the experts in the field of nephrology and cardiology who deal with day to day patients who are suffering from renal dysfunction and the comorbidities. Today, we have with us the clinical expert for the day, a very young and dynamic cardiologist from Mumbai, Dr. Mustafa Taskeen. Dr. Mustafa Taskeen is a director at Taskeen's Healing Heart, Kanderi, Mumbai. He has an expertise in interventional cardiology. He is currently affiliated with Criticare Asia Hospital and Sefi Hospital, Mumbai, and he has also been affiliated with Kokilaben Dhirubhai Ambani Hospital, Mumbai. He completed his residency from Leelavati Hospital Research Center, Mumbai. And today, he is going to address a very interesting topic which is hardly touched in the field of cardiology, and especially physicians being the first point of contact in such patients. This is a very important topic to be addressed. So, without taking much of a time, I would like to inform you that the topic for today is the need of alpha ketoanalogue in patients, in the cardiac patients, to mitigate the risk of renal dysfunction. So, with this, I would like to hand over the session to Dr. Mustafa Taskeen to share his expertise with the audience. Thank you so much.
Yeah.
So, you can share your screen.
Yeah. Host disabled. I'm not able to share the screen.
So, you can try now.
Yeah. Not able to share the screen, madam. Yeah. Okay. Yeah, madam. Thank you for the kind introduction. I'm Dr. Mustafa Taskeen, consultant interventional cardiologist from Mumbai. My topic for today is alpha keto analogs, the role of alpha keto analogs in cardiac patients, and what should be the strategy in order to mitigate renal dysfunctions in such patients. So basically, we are facing patients undergoing cardiac surgery day to day, having high amount of metabolic stress, inflammation, and catabolism. And such patients may have pre-existing CKD or acute kidney injury. They may develop acute kidney injury post-operatively. Therefore, protein restriction is a must in order to protect kidneys of such patients. But since they are undergoing cardiac surgery, they need nutrition. Protein restriction may increase malnutrition risk. Therefore, it is very instrumental and fundamental to balance both the protein energy nutrition as well as protecting the renal functions simultaneously. Therefore, we have a very excellent molecule, alpha keto analogs, which not only reduce the protein intake but also maintain the nutritional status of such patients by reducing the nitrogenous waste. So, what are the nutritional challenges in cardiac patients? Cardiac patients who undergo CA bypass surgery, such patients they have a pre-existing protein energy malnutrition. Such patients are frail patients, elderly patients having comorbidities like diabetes, hypertension, dyslipidemia, and they might be missing the guidelines of having 1 gram per kg body weight protein. So they are protein energy deficient. Also, perioperatively, there is fasting, there is delay of surgery, and the extent and duration of surgery takes a toll on the protein levels of the patient. Intraoperatively, the positive expiratory pressures, the surgeries, the sedations, they result in inflammation and systemic inflammation, and there is gastrointestinal atony resulting into a deficiency in the protein levels and nutritional deficiencies. So malnutrition poses a major risk in wound healing, and it results in longer ICU stays, causing nosocomial infections, and they cause a higher mortality. Malnutrition in cardiac patients manifests as chronic heart failure, cardiac cachexia, sarcopenias, and they result in coagulopathies and resulting in inflammation and endothelial dysfunction of the GI tract. Subsequently, such patients will have worsening recovery, longer ICU stays, increased mortality and morbidity, and decreased discharge rates from their hospitals. Also, anorexia results in further heart failure by causing tissue hypoperfusion, congestion, hormonal changes, and this results in cachexia and sarcopenia. Also, malnutrition has a very important role in progressing the atherosclerosis of cardiac patients by increasing the cytokine levels and increasing the oxidative stress and endothelial dysfunction. So, this results in further plaque deposition at the endothelial level and results in cardiac dysfunction, kidney dysfunction, and such patients are nutritionally deficient. Therefore, it reduces the immunity of such patients, causing infections and frailty and sarcopenia. Now, overall, malnutrition poses a major adverse cardiovascular risk and increases the nephrological mortality as well. And simultaneously, we also have fluid restrictions in our cardiac patients. Fluid restriction is advised in all heart failure patients with reduced ejection fraction. But as we restrict the fluid, the delivery of the nutrition to the patient is reduced. Also, CKD exhibits an elevated cardiovascular risk, causing heart failure, arrhythmias, and sudden cardiac deaths. We mostly find patients of stage 3, stage 4 CKDs have highest risk of cardiovascular events. We call it as the cardiorenal syndrome, where hypertension, oxidative stress caused by the kidneys, calcification at the arteriolar level, inflammation at the endothelial level, hypertension cause atherosclerosis, further resulting into arrhythmias and sudden cardiac deaths in kidney patients. In us, in patients undergoing bypass surgery, these patients have a very higher risk of AKI, as per the Journal of Thoracic and Cardiovascular Surgery volume, which was published in 2021. It showed that patients who are having advanced age, a lower nutritional status, low albumin level, and post-operative AKI, these patients have a double risk of undergoing AKI in 7 to 90 days post-injury. And if the injury persists for more than 90 days, they may develop CKD. And therefore, we have a very important dilemma. How should we improve protein levels in such patients? Higher protein helps in healing, but it increases the nitrogenous waste and at the same time causing burden to the kidneys. So, in order to address this issue, we have alpha keto analogues. Now, alpha keto analogues are basically nitrogen free analogues of essential amino acids. They carry a carbon skeleton of amino acids but lack the amino group, which is the nitrogen group. How does it function? It When we ingest alpha keto analogues, it undergoes transamination in the liver, where the nitrogen of the non-essential amino acids is converted into essential amino acids. So this allows protein synthesis with lower nitrogen intake. So the result is that there is less of urea generation and reduced burden to the kidneys. So this is the major mechanism of how keto acid analogs of essential amino acids can be utilized to produce essential amino acids from nitrogen group of non-essential amino acids. So when there is a protein energy metabolism, a nitrogen waste is being created and energy is produced from the protein source. Now, the nitrogen which is released from the non-essential amino acids, when it combines with keto acid analogs of essential amino acids, the nitrogen waste is recycled, and this is used to produce amino acids, essential amino acids, which are responsible for formation of hormones, for muscle growth, for enzymes and neurotransmitters. So this reduces the nitrogen burden, and at the same time it takes care of the protein levels in the body. So what is the benefit in such patients, in cardiac patients? So it helps us to maintain the nutrition in cardiac patients with low protein diet, protein restricted diet, thereby reducing the nitrogenous waste, which helps in protecting the kidneys under stress, and it also improves the biochemical parameters like bun and serum phosphate. It also reduces the incidence and severity of post-operative acute kidney injury, and it also helps in maintenance of muscle mass and further accentuates the recovery in such patients. It maintains a safe nutritional management, and it also helps in maintaining the protein levels in patients who are having protein restrictions. So, which patients should be considered for alpha keto analog therapy? All patients, cardiac surgery patients with elevated urea and creatinine, where there is increased oxidative stress and inflammation post surgery. In patients who are having stage 3, stage 4 CKD, where the eGFR is less than 45, 50, where the protein intake has to be restricted. In such patients with low nitrogen burden, keto analogs are excellent in reducing the nitrogen and the blood urea nitrogen and the urea levels. And in patients who are at very high risk of post-operative AKI, such as elderly patients with frailty, with low albumin levels, such patients can be prescribed with alpha beta analog. And obviously, patients with protein-restricted diet. So, what is the dosing and administration? Typically, one tablet for 5 kg body weight as a single strength and 10 kg body weight as a double strength. So, at least a patient weighing 50 kgs should at least have 10 tablets in a day. If it is a double strength, then it is can be taken as a 5 tablets per day. We have also sachet available for administration in those patients who cannot swallow and where the dosing is not dosing fluctuates. So it should be integrated with a low protein diet comprising of zero point 0.6 to zero point 0.8 gram per kg per day requirement, and we need to monitor the nutritional status in such patients by testing their albumin, pre-albumin levels, electrolytes, particularly calcium and phosphate. Why? Because there is hypercalcemia and gastrointestinal side effect, which is very minimal if monitored regularly. There are less side effects, and renal function parameters to assess the nitrogen levels. So my summary, I would like to summarize that alpha keto analogs are essential in maintaining the nutritional status in patients, in my cardiac patients who undergo severe major cardiac surgeries, by reducing the nitrogen content and at the same time reducing the burden on the kidneys. It balances the protein needs with kidney protection, which is extremely critical. They also enable protein nutrition and reducing the nitrogen load, and they can be given in patients of cardiorenal syndromes, in my cardiac patients, HFpEF patients, HFrEF patients with CKD, with having a high risk of postoperative renal dysfunction. Thank you, madam. Thank you.
Thank you, sir, for a very comprehensive presentation. So there are few of the questions I would like you to address, which has come from the viewers today.
Sure.
One is regarding the safety and efficacy of alpha ketoanalogue, especially like you mentioned that it is a nitrogen free protein. So when you compare it with the other protein vis-a-vis the alpha ketoanalogue, how do you see the safety and efficacy of alpha keto?
Yes, a very good question, Ms. Alka. So, alpha keto analogs are highly efficacious, more than 90 to 95% efficacious when compared with their counterparts in reducing the nitrogen burden in my patients of CKD with heart failure. We are coming across daily 5 to 7 patients of heart failure, and out of that, 2 to 3 patients, 50% of the patients are having kidney abnormalities. They are in stage 3, stage 4 CKD stage. So, alpha keto analogs have a superb efficacy, about 80 to 90%, in reducing the nitrogen load and at the same time maintaining the nutritional value and the protein levels in the body. We have to be very careful in monitoring the electrolyte parameters and the calcium parameters in such patients.
So is there any specific indicator, clinical indicator, before starting the alpha keto analog therapy, or is it just the post-surgical malnutrition that has been noticed in such patients?
Yes, the indication is that patient should be a frail individual with oxidative stress, with inflammation, with high blood urea nitrogen level or urea level, but requiring energy protein levels so as to maintain his daily metabolic demand. So in those patients, in those subsets, this alpha keto analogs helps in maintaining the protein levels, and at the same time is kidney safe. So is mostly beneficial in stage 3, stage 4 CKD patients with heart failure. So there is an indication, and we have to be very much precautious regarding the electrolyte levels, the calcium levels in such patients.
So, and lastly, I would like to ask such question regarding the patients who are under rehabilitation, like post the surgery, they are continuing their normal routine, and if they have been referred or continuing their therapy with the physicians as well. So, any message for the physicians, especially when it comes to the patient post the surgery, when the patient is continuing the therapy of alpha keto analog?
Yes, such patients who undergo cardiac surgery and have a high metabolic demand, but at the same time, the kidneys need to be protected. Alpha keto analog is an excellent and a safe molecule which not only balances the protein energy levels, prevents malnutrition, and at the same time it reduces the protein burden on the body, on the kidneys especially. So such patients who undergo surgery, they should be continued on alpha keto analogs at least a year or so that their muscle mass is maintained. It accelerates their healing process, reduces the inflammation levels, and thereby improving the overall heart failure and CKD parameters.
Thank you so much, sir. With this, we come to an end of the session. And just to inform the doctors who are watching us today that this session will be available on YouTube and you can watch it anytime as per your convenience. And you can share your comments or any questions that you have in this regard. And with this, I would like to give a vote of thanks to Dr. Mustafa Taskeen on behalf of the entire team of Saffron Formulations for taking out his time despite his busy schedule and sharing his very relevant and clinical thoughts regarding alpha keto analog as a therapy. Thank you so much, sir. It was
Thank
very
you.
crisp and comprehensive presentation, and I'm sure today that the doctors will be taking out too many insights out of this and practice in their daily routine. Thank you so much, sir, for joining
Thank
in.
you.
Thanks a lot.